Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I would like to welcome Dr. Felice Gersh, a board-certified OBGYN who graduated from the prestigious Fellowship in Integrative Medicine at the University of Arizona School of Medicine. As a graduate of Princeton University and University of Southern California, Dr. Gersh was recognized as the most accomplished female medical student and was awarded entry into the prestigious Medical Honors Society, Alpha Omega Alpha. Dr. Gersh has specific expertise in the realm of women's hormones and has worked to address the negative impacts of pharmaceuticals, environmental toxins, stress, and the aging process.
Thank you so much for joining us today, Dr. Gersh.
Oh, it's my pleasure.
I know you're right out of your breakout session where you delivered, I'm sure, a very inspiring talk. So what would you hope would be the number one, single most important message that you would have been able to deliver?
It's really clear. Estrogen has been the most maligned of hormones. It's really unbelievable. It's really the master of metabolic control in the female, and as such, it's involved in everything. And reproduction is just one small aspect of what it's involved with. And basically, there's a receptor for estrogen in virtually every cell of the body. And without estrogen, things really are not going to function well. So my take-home message to everyone for this particular talk was, and I had the entire audience repeat it, estrogen is gut protective, but the overall theme is estrogen is the master of metabolic homeostasis of the female body, and it's not really optional for good health.
So what does it mean to you to be in a room delivering a talk like that to, you know, whether it's dozens or hundreds or some, you know, potentially, you know, 1,000 people if you get on the keynote stage? What does it mean to you to be able to deliver a talk like that in front of like-minded physicians like yourself?
It really means the world to me because I've been in practice for many years now, and I have a mission. So I have actually several missions. One is to care for my patients because I'm still primarily a full-time practitioner. But it's really to leave a legacy because it's important for me to have an impact not just on one-to-one my patients, but really on other doctors, the future of American medicine, to change it, to change the whole paradigm from the, you know, pill to the ill into looking at each individual as the unique person that he or she is, and then formulating a real plan that makes sense based on real physiology, the real functions of the body, not just what symptom can we try to cover up today. So being invited to the A4M to have this opportunity to speak not just in person, but, you know, these things are recorded. Who knows, you know, down the road who might have access and listen. It really makes me feel like I'm making a difference. It's one of the ways I feel I have real purpose as a physician.
So let's go back to when you were in your early days, and what was the initial motivation for you to study medicine?
Well, way back, which is now many, many years, I grew up in a family that gave a very limited group of options in terms of what you could be when you grow up. It was very open. Being a woman, there was never any question about that you should have a different career path or no career path if you're a woman. In my family, it was you can do whatever you want and no difference between the boys and the girls. But my parents presented you could be a teacher, you could be a doctor, or you could be a lawyer. Somehow that just became the selection. I didn't have what a lot of people have today. Well, it's like you could be one of hundreds of things. So in some ways that made it easier. So I thought about it, and I was good in science, and I was really always a people person. So, and I didn't really think I liked the sort of confrontational thing of being a lawyer. And I thought, well, if I'm a doctor, I'm also a teacher because I'm teaching my patients, and, you know, who knows where the future might be. Like now I'm teaching other doctors and other healthcare professionals. So I chose being a doctor because it seemed like that was really a logical path for me. And then once I got into medical school, I went through the different rotations, and after I did obstetrics and gynecology as one of my rotations. I said, that is what I want to do. It was exciting and variable, and I got to know patients over, it wasn't just like a one-time deal where you just do a procedure and then they leave. I had a relationship with my patients. I had the adrenaline surges when things happen. You know, in obstetrics, you never know what's going to happen. And so I just loved doing obstetrics, and I practiced it for many, many years. But then the time came to give it up because my own health was going to suffer from all the nights and such. And that's really how I ended up going down a different road from conventional into the functional medicine world.
Was it a specific event, or was it just a handful of events, or what was it that was the catalyst for that?
It was that I lost a lot of purpose when I gave up obstetrics, because that was a very big focus of my career. I did gynecology. I was a very busy surgeon. But I kind of got my, the warm and fuzzies, primarily from doing the obstetrical part. And after I gave up obstetrics and I had, I guess, more sleep, a little bit more time, I said, you know, what am I doing? And now I'm just doing GYN, and it seems like my toolbox is really limited. I can do surgery, and I was excellent as a technician. I could, every technical procedure that came out, I did. I actually taught surgery for over a dozen years to residents at USC Keck School of Medicine. So surgery was something I was very comfortable with. I did a lot, but I didn't really want to do it forever. And I thought the more I kind of had time, it's like, why are we waiting until people have end-stage disease and we just watch and we say, when it gets really bad, we'll do surgery? It's like, can we be a little bit more proactive with this? And so the treatment for everything seemed to be either surgery or birth control pills. It's like, this seems like a really limited toolbox. And then there were a few other pharmaceuticals for like overactive bladder and for migraines and things like that that I dealt with. So as the pharmaceutical reps came through my office, we had a steady parade of pharmaceutical reps coming through. For the first time in my career, I said, show me your studies. I want to see exactly how this drug came on the market, because my career spanned what I call the heyday of big pharma. It seemed like over many years, like every month there was the new blockbuster drug that came out. And I was first out. I was an early adapter of every pharmaceutical, and sometimes I got burned. I mean, a lot of times I got burned. It's like after a while it got taken off the market or got a black box warning on it and so on. It's like, or it didn't seem to be very efficacious in my personal use with my patient population. So as these reps came through, I said, show me your data. And when I really sat down and looked at it, it's like, this isn't really much different than placebo. And it looks like if you went out a little longer, it actually matched placebo. And it really has a lot more side effects than placebo. It just, I was losing faith in what I was even doing. I started feeling, I had like a midlife doctor crisis. It's like, I don't have any purpose. The only thing I can do is operate on end-stage disease. And I just felt like, I felt really lost. So I started going out on sort of a journey. I started taking courses with, I didn't even know who they were, with naturopathic doctors. It's like, who are these people? And I started going up to Oregon and to Portland, and I started taking these courses. I said, these are really, nice people, but they're not me. I'm an MD, they're NDs. We have different backgrounds, but yet a lot of what they say is making sense. They're using herbs, they're using more natural lifestyle approaches, but I still felt like I had no mentor, I had no direction, no real plan. And I was at one of those conferences, and an MD was there, the only MD, and was giving a lecture on an integrative approach to migraines. It just happened to be. And I went up to her afterwards and I said, it was Dr. Lodog, and I said, Dr. Lodog, you and I are the only MDs in this entire room. Everyone else is a naturopath, and I feel completely lost. I don't know what to do. I have no mentors. When I go back now, I feel like I'm sort of in conflict with my doctor friends because we're actually thinking differently. I'm thinking pharmaceuticals should not be the only approach, and it's not really getting to the root cause of any problem. And the solution in OBGYN is always surgery or birth control pills. And she said, in like a week or two, the new fellowship program starts at the University of Arizona School of Medicine, so you should join my fellowship. and you should apply. I'm sure you're qualified from our little conversation. So I went home. I filled out the application. 2 weeks later, I was in Tucson. And I did the 2-year fellowship, and I loved it, but it wasn't enough because it really dealt wonderfully with mind-body medicine, but it didn't really get into enough of the functional medicine for what I wanted to do. So I went and started, but now I had direction and focus and purpose, and so I started taking a lot more courses in functional medicine, which was a wonderful adjunct to the fellowship. So it's like great, and then I aligned myself a lot with the A4M, and became a speaker here and went to all the conferences, multiple conferences year after year, and actually like every few months because, it would be here and in the Las Vegas. So I got to meet a lot of people, a lot of the speakers, and I've just expanded my world so much. It's rejuvenated my career, my purpose, my attitude, and my level of happiness has just gone up multiple layers. And I'm so grateful that I found my new home, my new tribe.
How did you initially implement everything you were learning into your practice?
Some of it's been trial and error because it's not easy. And I know that a lot of doctors in the functional medicine world are also struggling on how to make this profitable and how to do it in a way that you don't spend 3 hours with every patient and you really go broke really fast. So it's been something of a journey, and it's still an ongoing journey, but it's going very well for me. I gave up all of my insurance contracts, so I'm a cash-only practice. I have no contracts with anything, including Medicare, but we keep our fees reasonable and we give quality. We give value. And in the end, that's really what people want. They want someone who cares about them. I'm a very big believer in the healing relationship as really a stepping stone and really a foundation to helping people to heal. I can't tell you how many people just on the end of the first visit just give me giant hugs and say, I feel so hopeful. Someone is listening, someone is caring, and I have a plan. Because they've been going to the conventional doctor appointments, which are 5-7 minutes. Sometimes the doctor actually spends like 1 or 2 minutes. It's really amazing. How can you even take a history? Even like, I can't possibly even imagine it any longer, what they're doing. And they just feel so cared for, just coming to my office, that it really hasn't been a problem. And we've created our own procedures and protocols, and it's still a work in progress, but for sure there is definitely room for functional medicine practitioners, even in this world where something like, 70-80% of doctors are hospital employed. So many people are unhappy with that. They're not getting what they need, or their family members, and they pay for everything else. I mean, who's paying for them to buy good food? Who's paying for them to get a gym membership? So people finally throw their hands up and say, okay, so if this is a cost, then I will accept that, because I have no quality of life if I don't have health. Health is the foundation for everything else. And it's an interesting thing, because in my own family, we always had this ongoing sort of saying that came up sort of regularly, because people, would get ill, and they would say, if you don't have your health, then you don't have anything. Because it doesn't matter how much money you have. If you're in pain, if you're disabled, if you can't live the type of life that you want to live and feel happy, because then what is your life? So giving people the ability to optimize their health is the biggest gift anyone can give to another, because only with that can they really achieve anything else in life. And people are willing to go to a doctor like myself, who is a cash practice, and pay so that they have that possibility, because it's like everyone in this world now is sick. I mean, everyone has something, because we're all involved with the same toxic food. No matter how hard you try, you're going to get different toxins in your food, and there's so much about air pollution. I mean, there just is what it is, you know? So everyone is exposed to more toxins than they should, and everyone has different capabilities of handling it, but everyone has something, you know? So it's a question of looking at each individual and then helping them to get on the path to optimizing their health. And that's what's happening with doctors like myself in practices like mine, where we practice functional medicine and really care about the person and look at them as someone, not just a number, which is what's really happening in the conventional medical world. The doctors are so burnt out. I know so many of them. They're so burnt out and so frustrated with their very tiny toolbox and their very minimized visits in terms of time. They're unhappy, and the patients are unhappy. And through functional medicine training, education, and creating a practice where you really show the patients that you care, they will come. You know, the old saying, you know, if you build it, they will come, and they will. You just have to get the right staff and build in the right procedures so that the patients know that everyone in that office is together on the same team there to help them.
What advice would you give to one of your colleagues who's potentially teetering with the idea of transitioning to an integrative practice?
So for every doctor, they have to look at what do they want for themselves, for their families, and what are they willing to do? Because going out and transforming yourself and becoming a functional medicine doctor is not going to be like an overnight kind of a process. Are you going to really put in the work? Because this is work. For doctors to be successful as functional medicine doctors, they really have to make the commitment to the time, the cost, because it's not going to happen in a matter of a few days or weeks. It's going to be, to really become expert and feel really comfortable, I would say a minimum of 2 years in terms of really learning the foundations of functional medicine. Once that is decided, because if they're going to actually be in practice as doctors for more than like 2, 3, 4 more years, and they really want to be happy, they really should make the change. Because being a doctor in the conventional world is really a frustrating situation right now, and they will never find, they may get financially benefited, but they're not going to be happy and fulfilled as doctors if they simply continue to do the pill to the ill sort of foundational and poorly substantiated in any sort of way approach to medicine. So I would say, do it. I would say if you're willing to put in the time and the effort, you will get the rewards. But you know, it's like no one becomes a concert pianist in a day. If you're going to do that, how many hours are you going to spend practicing? So you have to go in with your eyes open, that you have to go back and start foundationally relearning a lot of things. I can't tell you how many hours I spend learning what is the Krebs cycle and learning about cell biology and physiology. I had to learn a lot of basic science things about genomics. I didn't learn these things in medical school because a lot of them were not even around then. And what I did learn, I long ago forgot, because in the way that medicine is today, doctors are not really called upon to use their foundational knowledge. They're really, the way that Big Pharma has sort of trained them is to dummy down the entire approach to medicine. It's like, in fact, it's so funny, really. I remember a pharmaceutical rep that came to my office a number of years ago and brought in a checklist of 5 questions and said, ask your patients these 5 questions. If 3 or more come back with a yes, then you should prescribe this drug. And it's like, doesn't this drug have like a lot of side effects? It can give you metabolic syndrome and all kinds of other. Well, yes, but that's okay. You know, these you'll get more benefit. And it's like, isn't this like a psychiatric drug that really should be prescribed by someone with maybe specialty training? No. Just here's the 5 questions, and you just ask them, and they just check, you know, 3 out of 5, and you just prescribe this drug. How this drug works, why you should use it, what's the exit strategy I found there's never an exit strategy. Once you get on something, it's for life. So that's the kind of approach that doctors have been trained with. You just ask these few questions, you give this drug, and you don't have to really understand how the body works. Well, that's not what functional medicine is about. You really try to understand what's really happening in the body so you can evaluate and look for root causes. And so that's not going to be learned in a few minutes. So the doctors, I think, who do not go in with recognizing that they're going to have to do some work, they're going to have to learn, but it's so wonderful to learn. I just find learning to be the most exciting thing. So this will not apply to every doctor out there. But if a doctor is even thinking of this, they've already made some big thoughts. Big thoughts have come into their minds, because you don't start considering going into a functional medicine career if you're already not dissatisfied with the one you've got. So the doctors that are thinking about it, they've already come that far. They should really explore it further and maybe even just put their toes in a little. Come to one of these conferences, meet other doctors, talk to, I love interacting, especially with what we call the newbies, the ones that are just trying it out, and just see what it's like, meet doctors who have jumped in fully, like myself, and have made a successful career of it, and understand what it takes. And I think that would be what I would suggest, because I'm just thinking it out as we're talking, because no one has really asked me that question before. So I would say go in with your eyes open, test a little bit, what's out there by coming to an A4M big conference like this one, or go to the next one, that's whenever that's going to be, depending on who's watching this when, and meet doctors who are already involved, because they will tell you, not just like I'm telling my path, they'll tell their path, and every path leads down the right direction, into the right direction, which is helping your patients. Because there's no one that went into medical school with the goal of not helping their patients and just trying to have a career, because you wouldn't go through all that sacrifice and all that work. So remember why you went into medicine and what is making you unhappy now in the career that you're in the conventional world. And then swallow hard and say, I'm going to do what's best for my patient. Because isn't that what we said when we took the Hippocratic Oath? And what's best for your patient is to learn functional medicine and to care for patients getting to the root cause and really helping them to get back on track to find optimal health.
What advice would you give them to overcome any criticism that they might receive from their peers?
That's the beauty of being part of this group, because we're like a support group for each other. And I totally identify with that, because I have worked to get a lot of patients off of pharmaceuticals, but not just take them off. I mean, we don't just take people off of things. We offer them a different option, trying to heal what's wrong, like whether working with their gut, working with their stress, sleep, hygiene habits, and so on. So getting to the root causes and then finding other solutions. Because so many people now are on antidepressants and tranquilizers and sleeping pills and drugs that block stomach acid, the PPIs, and I see these people, I'm sure everyone is seeing these patients, and I'm trying to help them to get off of these drugs, because I could rattle off all the side effects, dementia. I mean, everything sort of leads down the path to dementia and cardiovascular disease. So these are side effects that are real, and these pharmaceuticals don't address the real problems. So I work with them, but then they go out and they see other doctors, and they do give me grief, the doctors do, through the patient. They'll say, why is she taking you off that drug? It's really good for you. You should be on it. And it puts me at odds, which I hate, that I'm at odds. And I'm always looking for other doctors in my community that are sensitive to functional medicine goals and ideals. But you have to be strong. You need a good spine to take criticism from other doctors in your community. But it's growing, and there are plenty of doctors like myself who are there to support you, and you need to find your little tribe like here so that you'll see you're not alone. And the first response to anything new, it doesn't matter that it's right, it's just new or different, is always sort of ridicule. It is. The first response when someone doesn't know something is to ridicule it. So people need to know that. They have to be strong. Anytime you go against the popular, the most common thing, you're going to take some abuse. But when you know you're right, it's so much easier. It is so much easier to withstand the negativity of other doctors in the community. And more of them are looking for it for themselves. That's the funniest thing, because the other doctors, they have themselves as patients, and they have family members. And I have more and more of conventional doctors and their families coming to me because they're not getting what they need. So it's amazing. It's very doable. You have to be a little bit strong, but it's getting easier because the people who had it the hardest were probably from 10 years ago. It's getting easier now because no one knows what to do in the conventional world to really help patients. So when it's their family, suddenly they're showing up at your door.
It seems to be a common theme that if it happens to them and they're taking all these pills for their ills and they're not getting better, or their family member are, and nothing's happening. So that is a common theme that I do hear from physicians as to what was the initial impetus for them to seek alternative therapies for themselves or their family members. Additionally, I find it fascinating how many emergency room physicians have left the ER and joined this crusade because the pill for every ill, as you said, was not why they went into medicine. And to be able to, in the case like a practice that you have, to develop a relationship with your patient, as well as to actually get to the root of the problem, that's why you go into medicine. So it's fascinating. It takes some doctors longer than others, I guess, to get there. So. Well,
definitely. It's something of a very personal journey for every doctor to make the leap from the conventional world into the integrative and functional world, because it's not happening in medical schools. Very few anyway. There are few, but not many, because I talk to medical students and I'm always like in shock at what they're not learning. They come out and it's like, you need to go and take functional medicine courses because they're not teaching you everything you really need to know to be a really fully equipped and competent doctor.
So can we talk about you personally a little bit? What do you like to do in your spare time?
Well, I have 4 children, and 3 of the 4 live in a different state than I do. So my free time is spent trying to go and visit them. I have 5 grandchildren, and I want to be part of their lives, and they all live in other states. So I love to go, because it's very hard for them with their families to come to me. It's easier for me and along with my husband to go get on a plane and fly to them. So I try close to once a month. So it takes up my little bit of free time to go and be with them. And once we get there, we do lots of fun things. We go to parks and zoos, and sometimes we go skiing because they live in Utah and in Colorado. So we do lots of outdoorsy things. We go hiking. We just have lots and lots of fun. But that's what I use a lot of my free time for. Otherwise, when I'm just home, I have incredibly little free time, to be honest. And it sounds weird, but I actually enjoy reading medical literature. I mean, it's because I do. I'm sort of a junkie on reading and going to conferences. I really find
Seeking more and more information.
I do. I just think it's really, really fun. I get lots of scientific sort of magazine, journal kind of things, not just straight ones. Like Science magazine. That's written actually for the public, but it sort of consolidates a lot of scientific articles. And when I do have some free time to go and actually do things like skiing or go to the beach, because I live like 3 miles from the beach, and I love to go and I do my earthing and walk on the sand, and I have a nice backyard and I like to sit and relax. So I do have a little bit of free time for relaxing and having fun, and I have wonderful friends, and we go to the movies, and I go to a lot of shows. I love the arts, and so I love music, and I go to concerts. So, and I like eating out at organic restaurants.
So, speaking of which, so what kind of dietary lifestyle do you have?
I am very strict. I only eat real food. And I have a rule, I call it Dr. Gersh's Law, that I share with all my patients. It's very simple. Everything you eat should taste wonderful, be good. You know, why should you eat food that you don't like? But, and this is with very rare exceptions, I like to say, okay, if it's somebody's wedding or, you know, a big event, maybe. But otherwise, everything you eat should be good for you. There's so many foods that are wonderful for you. Why should you eat foods that's bad for you? By definition, food should be nourishing, not poison. So I'm very strict. I try to walk the talk. So I really restrict myself to whole foods, real foods. I eat tons of vegetables, which I tell my patients, you should try to eat 5 to 6 cups of vegetables a day, half of it raw, and I get pretty close to that on many days. Sometimes like, oh my gosh, can I take one more bite? Sometimes I have to leave the last bite. I just cannot take one more bite. But I really work very hard to be a role model for my patients. I feel that that's what a doctor should be. I just think it's so ridiculous if you go to your doctor and your doctor looks really ill. You know, now things happen to people, but if they have a really terrible lifestyle, then what kind of a role model is that? So I'm very strict about what I eat, and I love vegetables. Fortunately, my husband is the cook, not me, and he comes up with all these. You know, he goes online and
Did I read
recipes.
he works with you in your practice?
Yes, my husband is doing his second career. He used to have an advertising agency, and he moved on from that. And he was always, I call it, a gym rat. And everyone was always asking him advice because he was always kept up on, he read all the magazines about exercise and health for men particularly. And he became the go-to at his gym. And I said, you know what, you are way too young to be retired. So why don't you do what you seem to be doing anyway, only get a degree. And so he did, and he went back to school. Well, I was learning functional medicine, and he was learning how to be a fitness specialist officially. And so he got his degree, and after he had already an undergraduate degree at Princeton, he had a master's degree from USC, but then he went back and he got his fitness education and certification and degree and so on. And so in my office, he functions as our fitness specialist. And we do what is actually promoted by the American Medical Association, which is fitness is a vital sign and exercise is medicine. So he does fitness assessments, exercise prescriptions. We have a high-end body composition device so that everyone can get their really high-end body composition, because you can't monitor what you never measure. So we can actually measure their fitness status, their body composition, and then he gives them exercise prescriptions. He does some small and individual fitness classes. And we, once again, we try to walk the talk that part of health means movement. It means exercise. The body was meant to move. And so the data is so overwhelming that exercise is the answer to pretty much everything on top of the other ways of dealing with it. There's nothing that doesn't seem to benefit from exercise. So we try to incorporate that into all our health plans for every one of our patients. So he is, a very key member of my team.
So just to wrap up, where do you hope to see yourself and your practice in 5 years?
Well, I intend to be out there practicing for many more years. But if we limit it to 5 years, I do have dreams. And what I would love is for my practice to be the really mecca for women's health care in the country or in the world, as an integrative functional women's health specialty person with a board certification in OBGYN. I'm really the advocate for everything for women's health. And we're trying to create just amazing programs for women in terms of how to maximize your health and your baby's health. before you become pregnant, so that babies won't be born, who develop autism and attention deficit disorder and type 1 diabetes, for example, the incidence of which is about 700% higher than it was just about 15 years ago because of gut problems, and how to help women really to be healthy during their reproductive years, as well to get through the enormous, momentous occasion that is going to happen to every single woman. It doesn't matter what you do, every woman is going to deal with menopause. And I'd love to change the name into really what it is ovarian senescence. The period part is just one piece of this whole thing, and it's actually the smallest part when it comes to what's really happening to women from a metabolic point of view. And to help them so that what is potentially the second half of their lives is really as wonderful and with all the health and happiness that the first half had, because a lot of women really have a lot of medical problems after menopause. So what my goal for my practice is that we will really become renowned for women's health from puberty and even before all the way up to over 100. And that I will continue to travel and be part of conferences like this and educate not just the future doctors, but even the ones who are already in the field, because women's health is really neglected in terms of studies, in terms of understanding how women's hormones really interact. So even the doctors who are involved really need to get up to speed on really what's going on in women. So everything women and women's health is what I hope to really become known for over the next 5 years, and that my practice will become the go-to place for women who are looking for the best health care.
I'm sure with you at the helm, that will happen. So thank you so much for joining us. I really appreciate your time and your wisdom.
Well, it's been my pleasure, and it's really an honor to be affiliated with the A4M and the MMI.